Okay, for the bladder channel, so bladder 10 is going to be just caudal to the most cranial portion of the wing of the atlas on the dorsolateral neck region, here and here. Bladder 13, 14, and 15 will exist kind of midway between the spinous process and the medial border of the scapula. I can feel the two borders of her scapulae right here, and they exist from here to there. So in between those zones are going to be 13, 14, and 15 for the bladder channel. There's not a lot of space with her crouched position currently. The next easiest to find is bladder 21. So we're looking for the lateral aspect of the last rib. Okay, we're moving on to bladder 21, which I first find by palpating the last rib and moving up to where that intersects with the spine at the level of T13. In between the longissimus and iliocostalis muscle is going to be bladder 21. One space before that will be bladder 20, bladder 19, bladder 18. And then if we again use the caudal aspect of the rib but go perpendicular back, we're going to get to the spinous process between of L2. And between L2 and L3, again between longissimus and iliocostalis, will be our bladder 23 point. If we go to the outer bladder line on the lateral aspect of the iliocostalis, that's going to be our bladder 52. And then again, if we go to inner bladder line, one intercostal space cranial, that's going to be our bladder 22. Moving down to this sacral area, we're going to have bladder 27 and 28. So I can palpate the dorsal wing of the ileus on both sides while she's sitting down here, which is okay. It's okay, sweetheart. I'll turn her around a little bit here. There we go. So dorsal wing of the ilium, and then feeling for the sacrum in between. We don't want to go in the foramina, but bladder 27 will be just lateral to the first foramina of the sacrum. Bladder 28 will be lateral to the second foramina of the sacrum. There's 2 points left. There's bladder 54, which is going to exist just cranial to the greater trochanter of the femur. So I'm just gonna pop her in my lap for a second here, just like this, and flat hand palpation to find her greater trochanter, which is right here by my middle finger. So just dorsal to that point is going to be bladder 54. And then the final point is going to be bladder 60. And bladder 60 exists between the calcaneal tendon and the lateral malleolus. It's just going to be in that little groove right there. That's going to be bladder 60. And those are our bladder points.